Hi, I'm Stephanie Obergozo, and today I want to talk about some of the orthopedic problems that are caused by wearing high-heeled shoes, as well as what we can do about it to mitigate some of the negative effects. I am a recovering shoe addict. I have a really amazing shoe collection, and I used to practically live in high-heeled shoes, especially when I worked in retail. And I was on my feet sometimes for 6 to 8 hours a day, sometimes more, and I would wear really ridiculously high shoes, anywhere between 3 and a 5-inch heel. And since I got into corrective exercise, I've been wearing a lot more flat shoes. I've been trying to spend more time in bare feet. But recently I've started salsa dancing again after many years of putting my dance shoes away. And I noticed that after the first couple of rehearsals in my high-heeled dance shoe, which is a 2.5-inch heel, that I was getting a lot of pain, not just in my feet and in my ankles, but I was getting a really strange knee pain. My SI joint started to hurt on my right side, and my low back started feeling really tight. And so I am going to be designing a corrective exercise program for myself to counteract the negative effects of dancing in high heels. Most people might think, well, why not just dance in flats, or why not just throw away all your high heels? Well, realistically, most of us ladies are not willing to get rid of our sexy high-heeled shoes and swap them out for some orthopedic flats. So first I want to talk a little bit about what different heel heights do to the body, as well as different shapes of shoes. This is a very common one that business women will wear, or women who are in the workplace. And this is a 3-inch heel here, and it's a pointy high-heeled shoe. So looking at the toe box here, it is going to really bunch the toes together, and adding this 3-inch heel is going to displace one's body weight forward by over 30 degrees. Okay, so that means that every joint complex above the ankle is going to have to compensate for this forward displacement of body weight. There are several different compensations that can occur when someone is wearing a pair of high-heeled shoes. So I'm going to put this pair of 3-inch high-heeled shoes on now, and I'm going to demonstrate the most common postural distortion that happens when someone is wearing high-heeled shoes. Okay. So it's going to be different depending on your individual body, and for that reason I'm not saying this is exactly what happens and here's exactly how you correct it. It's going to be different for each individual. But one of the most common compensations that occurs is when someone is wearing a pair of high heels, you will get hyperextension of the knees. So the legs will extend beyond straight, and actually sometimes you can even see it bowing out the back of the knee. At the hip complex, what happens is often we roll into what's called anterior pelvic tilt, or a Donald Duck type posture, where your butt's sticking out over this way. Okay, now with these two postural deviations that occur, what's happening is the quads and psoas, or hip flexor muscles, are becoming tighter, as well as the lumbar erectors. There's a lot of compression and jamming that's going on in the lumbar spine. So women will often feel like their back is very achy or tender or tight. Now while this is going on, the hamstrings and the glutes are lengthening. They're constantly being put on a stretch, which is going to lead to weakness in that muscle group. So part of my corrective exercise program is going to involve really heavily strength training the posterior chain, making sure that I'm not favoring my quads and hip flexors, but strengthening the hamstrings, strengthening the glutes, strengthening the lumbar erectors, and also the lower abdominals to help pull the pelvis into a more neutral position. Having a heel this high is going to put a lot of pressure in the ball of that foot. And a lot of times women who wear shoes that look like this, when they take their shoes off, their foot still looks like this. So their big toe is kind of running away. It's called hallux valgus. And they might even develop bunions over time, or ingrown toenails and other issues from wearing a pointy high-heeled shoe. Now this is the extreme, but definitely a shoe that I would have worn in my retail days, in my younger days. This is a 5-inch heel here, and it's a stiletto. And so there is a little bit of a platform in the front of the shoe, but you're still looking at a displacement of about 45 degrees of a body that would normally be pitched forward wearing a heel like this. And there are going to be a lot of compensations, a lot of problems in the spine. It can lead to everything from tension, headaches, to pelvic floor dysfunction, to back pain, you name it. So high-heeled shoes really can cause a lot of problems. So let's look at some of the things that we can do to mitigate these negative effects. Number one, get a ball. Any ball will do. Tennis ball is good if your feet tend to be a little sensitive. If you're the opposite and you like to have a little bit more pressure, a golf ball will work well. This is a lacrosse ball, and what you'll do is step on the ball. You can start with it under the arch of the foot and then just roll, put a little bit of weight into that foot and roll back and forth all along the plantar fascia. So anywhere you find sore spots in your feet, and you just want to relax and breathe and let that ball work on the connective tissue on the bottom of your feet. So it's going to work on trigger points and potentially adhesions. 1 minute on each side is all you need for that. Number two, you can look at starting to train in a barefoot type shoe, like these Vibram 5 Fingers. So I use these shoes whenever I go walking. Not really a runner, but when I do feel like jogging, I will train very slowly in Vibram 5 Fingers, and I always do my weight training in these shoes so that I can start to strengthen those muscles in my feet. Because I used to actually have very, very flat feet, and I thought it was something I was born with. But like anything else, the muscles in your feet can become deconditioned, especially when they're bunched into shoes. So one of the best ways to strengthen them is just to spend as much time barefoot, which is preferable, or in something like Vibram 5 Fingers that separate your toes and allow them to splay when you walk and allow you to use your toes the way they're meant to be used. And then my last tip for today is yoga toe gems. Okay, you can get these on Amazon, and they're just these rubbery, they're probably made of silicone or something looking things, and you put them between your toes, and it helps to create that stretch that you need and to restore mobility to your feet and your toes. So these are the first few things that you can start with if you know that your feet are weak or if they're slightly disfigured from wearing high-heeled shoes. One way you can tell is if you just look down at your feet. If your big toes look like they're running away from one another, that's an indication that the weight distribution is not going into the right place, and you may end up with a bunion or with pain or with a problem in another joint complex in the body. So these are just a few things that you can start with today. I will be adding more videos onto this as I move myself through a corrective exercise program, and I'll be sharing more stretches and exercises that you can do that can help mitigate the negative effects of wearing high-heeled shoes. Thanks for watching. See you next time.